Yalimadat everyone, and thank you for joining us tonight. My name is Aliyah Lalji, and I'm your Northeast Health Board ONSEC. We're going to let Razia Rahmani from our IHPA start off the session.
Wednesday evening, and we are very fortunate to have Dr. Mohammad Dhanani with us tonight for a very informative session. Dr. Dhanani is a native of Boston, and he claims to be the first Ismaili born in Boston. I'm not checked the sources, so don't blame me. But he did get his undergrad from NYU in biology and Middle Eastern and Islamic studies. He did his a medical degree from University of Michigan, and he obtained his internal medicine and infectious disease fellowship training from Boston Medical Center. Dr. Dhanani has been also part of a vaccination trial with COVID with Johnson & Johnson. So I'll hand over the floor to Dr. Mohammad Dhanani to enlighten us more about COVID-19, various concerns we've been having over the past years regarding, prevention, treatment, and of particular interest, recent vaccination and more, queries that we have around vaccination at this time. So Dr. Dhanani, the floor is on to you.
Thank you. Yalimadat everyone. So as has been mentioned, I'm an infectious disease doctor. I'm at Northwestern University, but Boston has been my home for a long time. And I'm excited to kind of go through some of the interesting things about COVID that everybody should know and some of the future directions we have. So before I do that, I'm just going to mention some things everybody should keep in mind. So number one, new research comes out constantly. And so science is an imperfect tool. It's always refining itself. There are some questions that we are well suited to answer with scientific method and some that we aren't. But I'm going to really try to focus on the research proven facts. You'll see that I draw heavily from CDC recommendations. And many of you may know the CDC is the governmental agency whose job it is to protect the public health of Americans. And it's run by scientists and not by politicians. And in fact, most physicians and other healthcare workers use recommendations of the CDC every day in their patient care. As was mentioned, I'm also involved in a COVID vaccine study. It's unrelated to anything I'm going to discuss today. And I serve in that capacity through my work, my job, and I'm not paid for it. So I have no stake in that. Everything I mentioned today is my opinion. And what I mention is not necessarily the opinion of the Health Board, IHPA, or Northwestern University. So the outline for the next half hour for my slides will be just some basics about COVID, how it's transmitted, how you can protect yourself and your family, what to do if you test positive, how to quarantine effectively, and what the exciting news about treatment and vaccines is and has been over the past month or so. So just quickly, just to make sure everybody's on the same page here, COVID is a disease, and it's caused by a virus. That virus is called SARS-CoV-2. Now, SARS-CoV-2 is a coronavirus. Most coronaviruses cause colds, but some are deadly. You may have heard of MERS and SARS. Those are other coronaviruses that cause very severe disease, and now we have SARS-CoV-2. Antibiotics do not treat viruses, so if you have a viral infection, you get an antibiotic, it's not going to work. But in patients with COVID who develop a second infection because of a bacteria, that's where antibiotics can be helpful. So what are the symptoms of COVID? So symptoms of COVID can really vary. They can be like a cold or allergies, and I've listed symptoms of cold and allergies there. COVID can also be like the flu, or it can be like pneumonia. And in fact, we see a lot of people who come in with COVID that looks like pneumonia, with fevers, shortness of breath, and cough. COVID can also be like the stomach flu. There are also some symptoms that are really specific for COVID. We don't see them a lot from other causes, and that's a loss of smell and loss of taste. Finally, about 1 in 5 people, or 20%, have no symptoms of COVID at all. They feel totally normal, even though they test positive. And because 1 in 5 people can have no symptoms, COVID can spread very quickly. It was discussed in the media about COVID versus the flu, and COVID is about 100 times more deadly than the flu, just in case anybody is still under the impression that they're the same, because they're not. About 1 billion people per year worldwide get the flu, according to the World Health Organization. The death rate in that group is 3 to 7 people per 10,000. In the past year, as of a couple days ago, about 73 million people had COVID, and the death rate in that group was about 219 per 10,000. So you can see it's about 100 times more than the flu. Now, I know 219 per 10,000 doesn't seem that high, maybe, but as more people get COVID, many more people will die. So that's why we are all so worried about it. So who gets sick from COVID? The short answer is anyone and everyone can get sick from COVID. When we do more detailed studies, we see that men die more often than women. There was also some discussion over the summer about young people not getting COVID. That's not been true when we look at the hospitalized patients. We find that about 50% of people in the hospital with COVID are under the age of 40. People who tend to get very ill are people over 65 years old, people with heart and lung problems, and people with obesity. And I think it's worth noting, and I'll show that in the next slide, is that young adults often are responsible for transmitting COVID from person to person. So this slide shows a group of people, all of whom had COVID, and I'm not sure if you can see my mouse here. So this largest bar here with 705 people, that's the 20 to 44-year-old age group, and you can see it's bigger than all the other bars in the graph. So 20 to 44-year-olds seem to get COVID the most of people in this group. But you can see also that 75 to 84-year-olds, 85 and older, they don't make as much of the group as people who have COVID, but there are also fewer people in that age range in the population. This slide here shows death rates by age group. So you can see that people 85 years of age and older have the highest death rate. 10%, or 1 in 10 people in this age group dies of COVID if they get it. Going back to the 20 to 44-year-olds, you can see their death rate is 0.1%, or 1 in 1,000. So how does COVID spread? So COVID mostly spreads through the air. We think that it may also spread through direct physical contact between people and contact of shared surfaces. And many of you might have heard the term close contact. So what is close contact? Close contact is being less than 6 feet away from someone else, whether that's indoors or outdoors. We saw even in China in December, January, that COVID spreads within households very rapidly because people in households are in close contact. And close contact also extends in a time period too. So if you were within less than 6 feet of someone today, and you found out 2 days from now that person tested positive, then you were in close contact with them while they might have had COVID, because it goes back 2 days. And so you were exposed. So why does COVID spread quickly? As I mentioned, 1 in 5 people with COVID is asymptomatic, which means that you might have 20% of people with this disease walking around doing their daily lives and not staying at home because they just feel fine. Also, we've seen what is called super spreading events. So there was an example in Maine, which had very low COVID rates over the summer. There was a wedding reception with about 50 people. And after the reception, we found out over the next couple of days, about half of people got COVID. And then those people who got COVID went on, and that became 150 people who had COVID, and 7 people died. And those 7 people had nothing to do with the wedding reception, but just the way that it spread, they caught it, and unfortunately they passed away. So these hot spots can form. Now, if there is no testing, then there is no capture of spread. So you have to test in order to understand how COVID spreads. If there's no testing, it's still spreading, you're just not capturing it. I want to show this video here. It's very quick. It's from Brown and Harvard in a collaborative showing how COVID spread throughout the US in March. And so we can see, sorry, oops, just go back here. And there we go. So you can see here that in March and April, things started to get bad on the East Coast and the Northeast in New York and Boston. And that's kind of where the hotspots were. And then there were some hotspots in the Southwest. And then as Memorial Day went by and the governors in the South largely started to open up their states, then we saw COVID become more of a problem in the South. And that's where the hotspots were then, and in the Southwest. And as the summer went on into fall, then the Midwestern governors started opening up their states, and you saw COVID, you see it now, it's becoming red in the Midwest. And this video really only goes through the beginning of October, but where we are today, this is where we are today. So this is why we're also worried about COVID. It's everywhere. So how do we protect ourselves from getting COVID? So there are some things that are proven by research to be effective in reducing the spread of COVID. And one of them is social and physical distancing. So what does that mean? That means staying at home. That means only leaving the house if it's absolutely essential. So grocery store, pharmacy to get prescriptions. That also means avoiding gatherings that involve people who do not live with you. And finally, if you are somewhere with people that don't live with you, you stay 6 feet or more away from them. So just some useful tips. So that means maybe go to the grocery store early. Take a list with you so you spend as little time as possible in the grocery store. If it's an option, take your own car or bike to go places than to take an Uber or a subway or a bus, because that way you're in your own form of transportation by yourself. Walking is good too, but you have to be mindful of the distances you keep as you walk wherever you're going. The more distance you keep, the better. If you have the option of working from home, then that's a great option to take advantage of. If you have only the option to work in an environment with other people, then use a mask and a face shield to protect yourself. And studies show that people touch their face multiple times an hour and don't remember it. I certainly do that. But what's important here is to be mindful of touching your face and to wash your hands often. Another piece that's important in terms of reducing your risk of getting COVID is to wear a mask. Mask wearing has been proven by research to be helpful. So you have to wear a mask, but you have to wear it the right way, and I'll go through that. Your mask protects other people, and it also protects you. So it's best if we all wear masks. You don't need to take your mask off to use your phone. And another situation that we've seen COVID spread in is where people take their mask off to eat with other people they don't live with when they're indoors, like colleagues who work. We've seen it in a hospital, people getting together for lunch in a hospital setting, they take their masks off, they eat together, and then at the end of the day, all of them take COVID home. So how to wear a mask correctly here? So here's my laser pointer. So you can see this first person has a mask not covering her mouth or nose. That mask is ineffective. This person has a mask covering her nose, covering her mouth, but not her nose. Whether you realize it or not, you breathe through your nose and your mouth all the time. You should wear a mask over your nose for it to work. This person is wearing her mask over her nose and her mouth, but she has a lot of loose, the mask is very loose, and so it's not doing its job well. Your mask needs to be snug. And this last person is wearing it under her nose, and she has a kind of looser area, so this mask is not effective. So this is how you wear a mask: over your nose and your mouth, and have it be snug against your face. I want to just comment that masks with valves are not recommended. They do not protect other people effectively. This is another graphic here that shows how masks affect the risk of spreading COVID. So this person on this side of the graphic, this person is ill with COVID. Whether the person has symptoms or doesn't, we don't know. This person is healthy, and we're going to go through this person's risk in each row. So this is the highest risk. They're close together, and neither one of them is wearing a mask. When the healthy person puts a mask on, that makes the risk a little bit lower. It's now moderate risk. When the person with COVID puts the mask on, that risk is now a little bit lower further, and now it's low risk. If they both wear masks, then that's even lower. But the lowest risk is if they both wear masks and they're 6 feet apart or more. And this is what we should aim for every time. I know there was some discussion in the media about mask safety. So I want to just mention that masks are proven to be safe. They do not cause low oxygen levels or high carbon dioxide levels in your blood. We use them in surgery for hours. Dentists, veterinarians, it's not just in medicine and nursing. Many other professions use masks. And we don't see people have problems with oxygen or carbon dioxide levels. There was earlier advice over the spring that people shouldn't wear masks unless they work in a hospital. And that was because of mask shortages. Hospital workers couldn't get their jobs, couldn't get masks to do their jobs safely, and they were getting sick with COVID and they were dying. Now we have enough masks for everyone, so everyone should wear a mask. So useful tips on how to protect yourself. So as I mentioned earlier, don't eat with people that you don't live with, maybe even outdoors. A lot of restaurants, at least where I live, have put up these kind of outdoor areas. Some of them look really enclosed and they may not have enough air circulation to be safe. Now, we don't have science to support that quite yet, or at all. That's a very difficult study to do, but that may just be a way of reducing your own risk. Also, the plexiglass barriers that you may have seen for convenience stores and so on, those can be helpful. I don't know of any science there either, but I think that we may think those are helpful. If a person is not wearing a mask and walks into your business, you can ask him or her to put a mask on. I think that people sometimes need reminders. Also, we know that single layer cloth face coverings like scarves and gaiters aren't as good as the double layer cloth masks that people wear. So we should be wearing the double layer or triple layer masks if we can. And finally, using latex gloves all day may not be helpful, because if you wear the same pair of gloves throughout the whole day, whatever's on your gloves will spread wherever you touch. So it may be better just to wash your hands. So protecting family. So if you were exposed to somebody with COVID, you should know that tests are most accurate 3 to 5 days after your possible exposure. But as I mentioned, the ability to spread COVID starts before that. So if you've been exposed, the safest route is to quarantine yourself and then get tested about 3 to 5 days after the exposure happened. Some tests are more accurate than others. If a test is an NAT or a PCR, it's probably more accurate than an antigen test or a rapid test. Also, the way you do the test matters. So nasopharyngeal, and so that's like the swab they do that goes 4 inches into your nose and may make you gag. Those are very uncomfortable, but they're more accurate. That's why we do them. The nasal tests that go maybe an inch or so into your nose, those are less accurate. What if you test positive? So if you test positive, then you absolutely want to quarantine if you can. So this is all assuming you live with someone or some other people. So quarantining in that setting means you, if you can, get your own bedroom and your own bathroom. Nobody else uses that bedroom, nobody else uses that bathroom. I know that's not possible for everyone, but if you can. When it comes to time to eat, you eat alone in the bedroom by yourself with the door closed. So nobody else is around when you have your mask off to eat. And then for the rest of the day, when you're just at home, you stay in the bedroom by yourself with the door closed. And you don't share household items like glasses, cups, forks, spoons, knives, toothbrushes. Those you should only use yourself. Spend as little time as possible in shared spaces where other people you live with may be. And if you are in a shared space, you wear a mask the entire time. You can have somebody else in your household sanitize high-touch surfaces twice daily, and by that I mean doorknobs, kitchen faucet knobs, bathroom faucet knobs, cabinet knobs, cupboard knobs, the toilet handle, and you can sanitize it with like a Lysol wipe or a Clorox wipe, something like that. If you test positive, you only want to leave the house for essential tasks. First, see if somebody else can help you with them, get your groceries for you, go to the pharmacy for you. If you feel sick, call your doctor. And if you feel very sick, call 911. And some of the reasons people call 911 with COVID include shortness of breath, confusion, high fever, and chest pain. And if you call 911, you want to warn the ambulance and the hospital staff that you tested positive for COVID before you get there so they can prepare. This chart here talks a little bit about how to quarantine and what the time frame is for quarantine. So if you were exposed and your COVID test is negative, then you quarantine for 7 days after exposure. But as we know, the test must be done at least 5 days after exposure. If you have symptoms of COVID, whether or not you test positive, then you want to quarantine for 10 days after the symptoms started. And you have to have 24 hours without a fever, without using Tylenol or Motrin or ibuprofen or like an anti-fever medicine. And you have to be feeling better. So a couple of criteria there you have to meet in order to finish quarantining if you have symptoms. If you tested positive and don't have symptoms, then you quarantine for 10 days. And finally, if you were exposed to somebody with COVID, but didn't wind up getting a test, then you quarantine for 10 days after exposure. The test, as I mentioned, has to be 5 days or more after exposure. And people who have problems with their immune system, where they're on medicine from their doctor for their immune system or things like that, they should quarantine for longer. Science, the quarantine duration has been changed by the CDC, partially in recognition of economic hardships. The science is still more in support of 14 days of quarantine, but the official guideline, as you can see, is a little shorter. So if you don't have COVID and you're not in quarantine, how can you help? And that's a great thing to do. You can buy groceries or essential items for loved ones who are quarantining. You can think about calling loved ones who are quarantining and checking in on them, because being isolated is very hard mentally and psychologically. So you can see if there's a need for volunteers who can do errands for people in quarantine through your Jamaat Khana or other local organization. But if you do get involved to help, please do it the safe way. So leave groceries or essential items at the door of the person who has COVID or is quarantining. Don't go in their house or apartment. And don't come within 6 feet of that person either. So how is COVID treated? So there is no cure for COVID. Many of you may have heard of a medicine called remdesivir. The studies have shown that remdesivir reduces time people spend in the hospital with COVID, but doesn't necessarily reduce the death rate. Another thing people might have heard of is convalescent plasma. And that is when someone who had COVID and gets better gives a blood donation, and that blood is then given to somebody who is sick with COVID. It's something we have done in the past with other diseases. It's not clear that that is helpful. There's another family of drugs called monoclonal antibodies. Some of them are used for COVID, and they're very new, and they're used for people who have very mild COVID that don't need to be in the hospital. These are being used as part of active research studies, and so we're learning a lot about them. Right now, I think the data is, we need more data on what their effect is. One thing that is clear is that steroids can be helpful for many patients with COVID. And by steroids, I don't mean the steroids that athletes take. I mean the steroids that work on the immune system. And they have a proven benefit in reducing the death rate of COVID patients who have low blood oxygen levels. And I just want to mention that low blood oxygen levels is the most common reason that people with COVID get hospitalized. So we have been using steroids a lot over the past couple months. Steroids have some side effects. They raise blood sugar, they can cause confusion. But since COVID is such a severe disease for many people, we've been using steroids a lot. Okay, so how is the COVID, how is the COVID vaccine different? A lot of people have been asking about this. So COVID vaccine development has been very rapid. So the previous time, shortest time we took to make a vaccine was about 4 years. We made a COVID vaccine in a matter of, what, 9 months or so? That's possible because we're using some new technologies. Older technologies take more time to develop a vaccine and then to manufacture it at a level that it can be used in a population. The COVID vaccines, the way they're being investigated right now is to see whether they prevent people from getting COVID. You could also look at COVID vaccines to see whether they prevent people from spreading COVID, but that's a bit of a more difficult study to do. And I think the focus right now is just preventing illness rather than preventing spreading. The types of new technologies we're looking at, mRNA is the first word I want to use here. mRNA is the backbone of the Pfizer or BioNTech vaccine that came out and has now been shipped across the country. Many of my colleagues are getting it too. That's 2 doses, 3 weeks apart. That same technology, mRNA, that's also the backbone of the Moderna vaccine. That's a vaccine that we think might get approved, emergency approval on Friday. That's 2 doses, 4 weeks apart. So the ones that are closest to being given out to people are the mRNA vaccines. The other vaccines that are in later stages of research are vaccines that use adenovirus. It's a different way of programming human cells to make COVID proteins. I'll get into that on the next slide. But the manufacturers of the adenovirus vaccines in late stage research are AstraZeneca and Johnson & Johnson. So this slide here, that shows you the 3 different ways that we think about vaccines. So number 1, that top one here, so protein-based. So this is the method we use to make a lot of vaccines that we've been using for a long time. This is a time-tested method of vaccine development, where this is the virus here, you take a protein on the outside of the virus, this spike protein, and you inject it in people so that their immune systems learn to recognize it. And so then when that person's immune system sees it later in an infection, they already know that protein and they attack that protein and the virus that makes it. This bottom pathway here, this mRNA here, this is what the Pfizer vaccine and the Moderna vaccine use. So mRNA is something that you make as a human being. It's a copy of your DNA. Your DNA is copied into mRNA, and then that mRNA is used to make proteins. So every life form requires proteins to stay alive. So what the Pfizer vaccine does is it injects people with mRNA that codes like a blueprint for the virus's spike protein. So your body will then make the virus protein, and then your immune system will see it, will recognize it's not yours, and will attack it. And then when you see it as an infection, you will be prepared for it, and you won't get sick from it. This one in the middle here, this adenovirus, that's the 3rd way we've been making these vaccines, and that's the AstraZeneca and the Johnson & Johnson approach. It's just a different way of giving human cells the blueprint to make the spike protein for the immune system to recognize. So I just want to mention here, all these approaches involve getting the human body to recognize the virus's spike protein. These are not live vaccines. This is not a real live virus we're putting in people's arms that can then be used to immunize people. So is the COVID vaccine safe? And I think this is something that a lot of people have been thinking about. So the data that the FDA looked at was studies by Pfizer that involved about 40,000 people. And 40,000 people, but 20,000 got the actual vaccine, and 20,000 got what was injected in the arm without the vaccine itself. So mostly like salt water. And overall, they found that the people who got the actual vaccine had a 95% lower risk of getting COVID than the people who got the placebo salt water. Some common side effects: injection site reaction was the most common, and that is redness, swelling, and pain at the site of the injection. So you can see that 80% of people who got the actual vaccine had that. 15% of people who got the placebo salt water got that. A lot of people also noticed fatigue. So 60% of people who got the vaccine had fatigue. 30% of people who got the placebo salt water had fatigue after the injections. Headache was also common. 50% of people got a headache after the vaccine, 30% after placebo salt water. Chills also were common, 30% in the vaccine group and 10% in the placebo salt water group. That went up slightly for the second dose. And when they looked at who got side effects like this, they saw that people who were in the age range 16 to 65 tended to have these side effects at a higher rate than people over 65. There were some serious adverse events. Bell's palsy was described, which is people lose, they get weak in one half of their face. But the serious adverse events generally were no more common in the vaccine population than they are in the general population. We don't know the long-term side effects of this vaccine because we really haven't had the vaccine too long. The average follow-up for these patients in the study was 2 months. But as time goes forward, they're going to continue to get information about how these patients are doing. So some specific questions for specific people. What if you're pregnant? Now, vaccine trials tend to exclude pregnant women. Even the one that I'm involved in, we exclude pregnant women. And however, if someone gets pregnant during their participation, we take note of it. And so in this trial, 23 pregnancies occurred across the 40,000 people over the 2 months that they were monitored. There were some children in the study. About 100 children ages 12 to 15 were included, but that's such a small number, it's very difficult to understand whether or not the vaccine is effective or safe. We need that requires more people in that age group. People with prior COVID who either had a positive antibody test or a positive nose test, we saw that the vaccine was protective in them and that they didn't have any worse reaction to the vaccine when they got it. That was initially a concern. And we also saw close to 95% efficacy in people who had lung disease, heart disease, diabetes, high blood pressure, and obesity. If you remember, some of these people are the people who get worse COVID when they get it. So this was actually a very important and positive finding. People with cancer were also looked at, and their efficacy was about 80%. So not quite on the scale of the other people. So how will a COVID vaccine be distributed? So as I'm sure many are aware, distribution will happen in stages or phases. Healthcare workers are getting vaccinated first, then people who live and work in long-term care facilities like nursing homes and rehabs. Although the distribution details are being left up to the states, and so they may vary based on where you are. I fully expect vaccines to continue to be a common topic in the news because the approvals that the Pfizer has and Moderna is trying to get, they're emergency approvals. They're not final FDA approvals. So that means there's going to be a lot of ongoing research being done while the vaccine is being given. And so we will learn more about the vaccine. And that's true for every drug. Every drug that comes out, we keep an eye on things even after it's fully approved. New vaccines with other technologies may hit the market. So as I mentioned, that protein subunit method of making a vaccine that we've done for a long time, we very well might see one of the candidate vaccines that are like that come and hit the market. We're not sure about vaccine cost. I think the government has said it will be free, but I think getting health insurance for the upcoming 2021 year might be a good idea for everyone. What about other vaccines, non-COVID vaccines? So it may be important to consider them. So, we know that the flu vaccine is effective and we do recommend it. And if it's advised for you, you may want to seriously consider getting it. Also, people who take medications for whatever health problems they may have, some of them may qualify for pneumonia vaccines. And so if you are somebody who takes medications, you may want to ask your doctor whether you're due for a pneumonia vaccine if you qualify. Finally, the flu vaccine does not offer any protection against COVID. It's a separate virus. And that's all I have for my presentation. Thank you.
Thank you, Dr. Dhanani, for a very informative session. We have a lot of questions and very good turnout for this session. So I'll start addressing some of these questions which are coming through from all different directions. The first one is to do with the quarantine and the testing for COVID itself. Will the COVID test result be negative after 10 to 14 days of quarantine? And after 15 days, do I have to retest it? And if I retest, if the test still is positive, what do I do?
Yeah, so, we initially over the summer, we were doing what was called a test-based strategy for people, where we would not let them out of quarantine until they tested negative. Then some additional science came out showing that in people who don't have an immune system problem, they tend to develop effective antibody levels at about 10 days, which means that they tend not to be able to spread the COVID or get very sick from it at 10 days if they're doing well for the 10 previous days. So right now, the recommendation is not to get retested for the general public unless you speak to your doctor and you have some other health problem where that maybe it's a little different, like if you have an immune compromising condition.
Okay, so there is no need to be retested after finishing the quarantine. Another question is, about the vaccine. Would the vaccine be available to people who have already been infected with COVID and presumably had the antibody test positive?
Well, the trials, the Moderna studies as well, they both, the ones seeking approval or with approval right now, they did include people who had positive antibodies. And so I think we will be offering it to people who have positive antibody tests. We don't know how long people are protected from COVID if they have a positive antibody test. With other cousins of COVID, other coronaviruses, we do see that immunity can wane. So I think that's why we're continuing to vaccinate people who had prior positive antibody testing.
See, and then another recurrent question is the vaccination safe in pregnant and childbearing age women? And should they go and get this vaccination? There's been a lot of misinformation and articles in lieu of that, where people are saying, oh, it affects fertility or something like that.
Yeah, so I think the short answer is we simply don't know. So we simply don't know how this vaccine will affect long-term fertility. We know that other vaccines generally have been safe. The professional organization of women's doctors, so the American College of Obstetricians and Gynecologists, has generally recommended getting the vaccine because they feel like the benefits of the vaccine outweigh the risks. We also know that COVID itself can cause problems in pregnancies. And I think that the women's doctors carefully assessed that when they made their recommendation about the vaccine.
Another question is, if someone gets the COVID vaccine, can they still transmit the disease?
That's a great question. I think that we don't have a direct scientific answer for that question yet. If you look at a group of some studies show that if you have antibodies, your ability to transmit it goes down. And then there's another study that says if you get the vaccine, you get antibodies. Maybe you can piece it together and say probably getting the vaccine reduces your ability to transmit the disease, but we don't have a single study that was done just to answer that question directly.
I see. Other questions are regarding, the recent news that we've been hearing regarding Pfizer vaccine. Two of the patients, two people who got the vaccine in Britain got anaphylaxis, and there is a case that's reported today where someone without any history of allergies had a bad reaction to the vaccine. So what's the recommendation in two groups, someone who has allergies and someone who doesn't know if they have any allergies? What should they do?
Yeah, well, I think the recommendation is that if you have a history of having a severe allergic reaction called anaphylaxis, that means your throat closes or your lips swell, you may get short of breath, you may need to be hospitalized, you may need an EpiPen. Those people should talk to their physicians before getting the vaccine. And that if they get the vaccine, they should do so with an EpiPen. I don't know that there is a recommendation for people who don't know whether or not they have an allergy. I think that we can't, test everybody for every allergy under the sun to make sure that they won't have an anaphylactic reaction. That's just not feasible. So I don't know that there is a precaution to take in that situation.
Right. There's another question regarding the vaccination. I think some people may have joined late and they may have missed your very nice graph that you initially presented, the age group graph, where younger people get more COVID, but it's more fatal in elderly population. So this one is more to do with the vaccine. Is the efficacy of vaccine, is the vaccine shown to be more efficacious in certain age group versus other? For example, is it different in someone over 65? Is it more effective, or is it same throughout?
Yeah, I don't think it's different in a way that is informative. I mean, the numbers may be off a little bit, but not in a way that should really affect recommendations.
There's some other concerns about people wanting to go to Kane, and they're, just covering the basics of prevention. Should they wear, what kind of mask should they wear to Kane? Do they need to wear eye shield when they go to Kane? Should they go every day, or maybe just go once a week, or something like that?
Okay, so I think going to Kane, like one thing that I think our institutions have done very well is taking proper precautions around Kane. I know there was a lot of thought given to how we would go about doing Kane in this strange times. And so I think we should all be grateful that we have that degree of protection from our institutions as well. I think that the decision about how often to go to Kane is really up to the individual, and how I don't know that I have a firm research-based recommendation about that. And the face shields, I think, are a good idea. I think the research points more strongly towards wearing a mask. And so what type of mask should be worn? Well, if everybody wore a multiple layer cloth mask, I think that would be ideal. We don't, N95 masks we're still usually using for healthcare workers. I know there's something called a KN95 mask that there is some misinformation about. They're not N95 masks. They vary greatly in their quality. So I would not wear a KN95 mask and think that I am wearing an N95 mask. Was that everything?
We still have some more questions.
Oh, sorry, did I
coming.
cover that question? Was there more to
Yeah,
that question?
I think so. That's about it. I personally think that institutions are managed pretty well, and we are social distancing and wearing masks, and that's universal. We have multiple checkpoints, so that's I think that we actually nailed it. There are quite a few questions coming about vaccination, and this one I heard from someone else earlier today. This Pfizer vaccine, which is a 2-dose vaccine, should you have the vaccine from the same provider, or can you go with different providers?
Yeah, so that's something that we don't know a whole lot about quite yet. I would think that since the study, that 95% number comes from a study of 2 people getting the same manufacturer, that if you get the Pfizer, you want to stick to the Pfizer. If you get the Moderna, you want to stick to Moderna. I don't think anybody is going to study whether you kind of cross back and forth, whether that is effective. I mean, it may happen, but I think that the science will probably say to stay within the manufacturer that gave you the first dose.
There was another more general questions about vaccines and how they are different, the RNA vaccines, because now we have multiple vaccines that are available. Pfizer is the first one to be approved, but there's Moderna, there is AstraZeneca. So how are these vaccines different?
Yeah, so I mean, it gets a bit technical once you talk about differences. So I think that it's all about the delivery method, right? The adenovirus vaccine uses a weakened second virus to get into human cells and then deliver the genetic material for coronavirus, protein from coronavirus. And that's how you get a human cell to make the coronavirus protein. The mRNA vaccines basically do away with that first step of that adenovirus carrier or vector, as we call it. So it's just different methods of getting a human cell to make the coronavirus protein so that the immune system can see this protein, learn about it, and learn to attack it when they see it again.
Right. I mean, at this point, the only vaccine that's available is only Pfizer, at least in United States and worldwide at this time. Another question is how long does the immunity last once you are vaccinated?
Yeah, so that's a question we simply don't know the answer to.
Right. If and when Moderna is supposed to be FDA approved sometime this week, some people have raised this recurrent question: if there is more than one vaccine available, which one should I take?
Yeah, I don't know that it really makes a difference. I think that we will have to look at specific populations. For example, will we see this anaphylaxis reaction with the Moderna one too? But I think that one thing to keep in mind is that these vaccines are not going to the general public quite yet. They're first going through healthcare workers and then through people who have underlying conditions, people who live in nursing homes or rehab facilities or who work in those places. So before we get to the general public, there's going to be a lot of people who get these vaccines, and we're going to keep our eyes out for things that happen, further information about safety and efficacy. So a lot of these questions about which vaccine we take right now, we might not know the best answer, but as the time goes on, we may have more information on how to best address that.
There's another question. If someone gets infected with coronavirus, can they get reinfected?
So we have seen cases of reinfection. It's been something that has been getting some news, and we are trying nationally to improve our ability to capture these events, because that's something that, especially as we're thinking of medications and vaccines, we want to make sure we're aware of. So yes, the short answer is yes.
So if someone actually gets the COVID-19, if they did get COVID-19 sometime during this year, can that affect your immune system? Do we know some permanent damage or long-term damage from this? If they had it and they've recovered and they're just worried.
So that's a good question. There is a group of people who got COVID-19 and then had ongoing symptoms like shortness of breath, fatigue. They're called longhaulers. We're kind of learning more about, what makes people more likely to become longhaulers. We don't know about definitively the answer to the immune system long-term effect, but it seems like there may be something that COVID can cause that makes people not feel great for several months. And I think that, again, hospitals that are large enough are trying to get research projects started so that we can get some answers about this.
So we did talk about pregnant women. There's similar sort of concern about children younger than, I think it's like now 16, right? 16 or 18. The vaccine is approved and being tested only on someone older than 16 or 18. So what about the kids? Is the vaccine available for children, or that's off limits right now?
Right now, we don't have it offered for kids simply because the studies weren't done in kids. This is not unusual. This is kind of how things go. We usually do new vaccine or drug studies involving a general public, and we don't involve kids or pregnant women first. And then as time goes on, we learn more information. Then we kind of can make recommendations about those things to kids and pregnant women. But that's I think some time away.
Okay, then there's some more, news stories that we've heard of regarding vaccination, and there's something about paralysis of the face called Bell's palsy. A few cases of that have come through, and everyone's been hearing about that as another side effect. So, what are your views on that?
Yeah, so we did see the patients with Bell's palsy, but we expect a certain percentage of people to get Bell's palsy out of a given set of 40,000 people. And in the vaccine study, it didn't seem significantly different. So some of these things that happened, they got captured because when you're in the vaccine study, everything that happens to you gets captured. But then we always compare it between the people who got the active vaccine and the people who got the saltwater placebo. And we also compare it between the people in the vaccine study and the people in the general population. And so it didn't seem like there were serious adverse events from the Pfizer vaccine that were more prominent than would be seen in the general population.
Someone has asked a question about flu vaccine. Does the flu vaccine help in preventing COVID or vice versa?
They would have no, flu would not protect against COVID, and the COVID vaccine won't protect against the flu. But the reason that I think many physicians are encouraging people to get the flu vaccine, especially this year, is because if you get flu and COVID at the same time, that's two diseases that are both very strong and can really hit your lungs at the same time, and that can be really lead to an unfortunate outcome. Fortunately, we have not seen that much flu this year. Everybody being mindful of mask wearing and social distancing has also cut down on transmission of the flu. But I still think it's a good idea to get a flu vaccine.
So then there is a concern about, we are almost coming to an hour, but there's another one which I think is a common question which a lot of people have. Someone's parents are older, over 80, but they've been housebound because of coronavirus. So do they need to take vaccinations? They have really not been outside since March.
Well,
and they're in the older age group and they may have other comorbidities like diabetes and hypertension and whatnot.
so this is specifically the COVID vaccine, or is it any vaccine?
COVID vaccine. They're saying that, well, we've been precautious, like we've taken all the precautions, we've been housebound. Now they are older. Should they get the vaccine now that we don't know the long-term effects of it?
Yeah, I don't think this COVID vaccine is going to make COVID disappear overnight. And I think that the way that it's going to be rolled out with various parts of the population getting it at various times, I think that we may not see a COVID completely disappear. And so I think for that reason alone, it may be a good idea to seriously consider the COVID vaccine when it becomes available, because we just don't know that this is going to completely go away forever. It really
Yeah.
depends on how long the immunity lasts.
Yes, this has been a recurrent question. Even younger people with good immune system have been questioning whether they should get the vaccine now that it's available, or should they wait a couple of months to figure out what everyone else is doing before they jump in. So should they get the vaccine now, or should they wait and watch?
Yeah, well, I mean, so the only people who can get it now are healthcare workers, as far as I know. I think that it really, young people can get very sick from COVID. There was a study that came out just in the last week where in July, we usually see about 11,000 deaths among people aged 25 to 44. This year, we saw 16,000 deaths among that age group. So young people can get very sick with COVID. And so if you are thinking about getting the COVID vaccine or thinking about not getting it, you just want to kind of be vigilant about what that might mean for your situation. And I think also we may see people get a little bit relaxed about masking and social distancing because they think a vaccine is here. And so we may see a spike in COVID cases if people kind of get tired of masking and distancing because they think the vaccine is here and it's all going to go away. And I don't think it will.
Very, very well put together. So I'm gonna address the last question. There are lots of questions coming through, but this is also recurrent. If someone is immunocompromised, should they get the vaccine?
Well, I think that's an important thing to think about if you are immunocompromised. I think you want to talk about your specific immunocompromising condition with your doctor, because that I think that's the smart thing to do. I would probably leave that to the expertise of your doctor because that's a big group of different diseases. Immunocompromised is a very broad term.
Right. So it's case by case basis, and you really should talk to your doctor and have a plan for yourself. And every day there's some other article that we read, and what we read today is completely opposite of what might have been published the day before. So I think case by case approach is probably the best way to go. So it is top of the hour, and this was a very, very informative session. And thank you so much, Dr. Dhanani. And we'll let Dr. Lalji do the closing remarks.
Thank you both, Dr. Dhanani. This was very helpful, and I can see we had a very active audience. So thank you for the Jamaat for sending in your questions and staying on throughout the Q&A session. If you have any additional questions, you can please reach out to us. And I just like to remind everyone, holidays are approaching, please stay safe. Continue to wear a mask, wash your hands, keep a safe distance, and we want you to stay at home as much as possible. If you're planning on visiting family, this is a very, very critical time. And I think, continuing with the distancing, avoid travel as much as possible. And, we really, we're seeing a lot more cases within the small gatherings. So please try and avoid physical gatherings as much as possible this year. And inshallah, you know, as we get into 2021, things will start to change for all of us. But thank you all for joining us tonight. Thank you, Dr. Dhanani, and thank you, Dr. Remani, for moderating the session. Have a good evening, everyone, and please stay
Thank
safe.
you.